The RWJF Awards for Health Equity program recognizes and celebrates individuals who have successfully implemented systems changes to reduce health disparities and to move the nation toward health equity.
Systems changes happens at multiple levels. One is there is a move talking about integrated care, but there is a disproportionate allocation of resources that go into the healthcare arena. We need to make sure that those provide behavioral services, mental health services also get resources. So it's bringing resources to the community. That's when systems change. If we don't have a perspective of respecting the community or recognizing their cultural differences, not all Asians are alike. If you look at Asian American, Native Hawaiian, Pacific Islanders, there's a huge diversity. So as a psychologist, some of the things that I had to really learn is that even though I may have the degree, I don't have all the answers. So I think for each of us, it's really looking and saying, what do we bring to the table? But what else is brought to the table by the community? What do they have to offer? And I think if we don't start with ourselves, I think it's a very dangerous path to assume that we have all the answers. So systems changes absolutely must start with ourselves.
A living approach fits very well within a model of systems change or thinking about systems change. And the reason for that is that you cannot change a system all at once. It takes steps. Just as you live over the years, these programs change over the years. Because we can all understand what it's like to be alive and what you have to do on a daily basis to live and how you have to adapt to a different environment. So it's a little bit more of a real message, a real approach for our team. And so we can work to make systems approaches but in a way that is living.
When we're talking with the community and educating the community, we're talking about the kind of approach we would take. You know, I'm an African American woman, and if I wanted to learn or if I wanted to gain information or get information about changing my health, how would I want that information delivered to me? I would want it delivered to me in a way that's digestible, in a way that I can appreciate, you know, in a cultural competent way, in a way that, you know, I know what I like. I like to learn a certain way by hands-on. So I'm going to find ways to deliver those messages to our people in a really unique way. So it's really taking an approach that is enticing, that's fun, that's relevant. And so yes, how do you approach our community in a way that's pleasing to everyone?
In the last 2 years, particularly because of our underserved residency program, we have intentionally tried to grow our clinical piece and to measure our outcomes, because that is kind of the missing piece also with charitable pharmacy care. You know, we can provide medication, but do we get the outcomes from providing the medicine? So in other words, are patients adherent? Does it avoid hospitalizations? Does it avoid emergency room visits? Does it help them with medical home placement? Does it help the community with estimated cost avoidance? And we can now say yes to all those things. Our results are outcomes based. And we now have we know that we have a successful healthcare model.
I think we start out with the strengths and keep things focused on the strengths. Eventually a young person will identify what struggles or what deficits they have, and if they're ready to work on them. But again, I think traditionally we've approached youth work from, this is what's wrong with you, this is what needs to be done, instead of allowing the young person to be their own resource and pointing out what's been working well, or what skill or talent they have, and how can we best utilize that talent to meet your goal. So I think, again, focusing things from a strengths-based perspective is crucial to youth work.
What it means is when people see you, they know that they're going to think, let's drink some more water. Maybe we should do the simple things that can make powerful changes. It doesn't mean system change agents. Really what it means is that you try to do the next right thing, and you continue to try to do the next right thing, and you encourage others around you to make choices for better health. And it doesn't mean any of us are perfect, but what it means is that we keep trying.
This is when we really begin to make systems change, when we put in place the kind of things in our community that are definitely going to improve a certain population. So whether we look for people involved with mental health issues and they don't have access because it's too expensive, but we find out there's an evidence-based practice that we can use peers of people who've recovered from mental health and oftentimes substance abuse problems, and they can become the trainers, then we really have a great opportunity again to make the improvement in the system of how we deliver behavioral health. If we're not going to get on the front end of things, if we're going to go back to a system that takes people who are in the street, have a real problem, don't know where to go, and finally go to the emergency room and find out they're in stage 4 of some disease, and at the most expensive, most difficult part of recovering from that disease, we are not going to get health equity, because health equity is getting people what they need when they need it. So what we have to do is create that system so that people can get there and create the laws and create the legislation to make sure that people feel that they have responsibility for their own health and a way to execute how they can be responsible for their health.
The fear of approaching these big systems, even though, I work in a big system, and yet I still have the fear, can we really go and knock on the door to really improve the health of our community? Can I go and ask for money when money is needed to further our cause? Can I ask this group of people to volunteer? These are all things that are bubbling in your mind. It's like, can we work together? Can we be viewed as a group that's really serious about how all these things kind of bubble up? But what we've done as a Colorado Black Health Collaborative to overcome some of the challenges is really make sure to tap your resources, your volunteers. Try to become fearless. Although we may be shaking as we go to open the door, we still know that we have to do it if we want to make some strides. How do we get to the next level of healthiness for our community? What it looks like for our community is different than what it may look like in some other communities. But for our community, we're saying we're experts. We're experts on our community because we've talked to the people. And taking that blueprint and moving forward, writing it down and using that to move forward so that we can actually achieve our goal of becoming the healthiest Black folks in the United States, and Brother Jeff says, on the planet.
In addition to this YouTube channel, we encourage our viewers to go to rwjf.org for additional resources on achieving health equity.